Hi, I'm Ida Green, your early interventionist, and I am excited to be working with you as a collaborative team member to help this family. Okay, I want to give you a little background history on our case. We have a female who's 35 months old, and she was diagnosed with autism. Her birth history, she was full term, 40 weeks gestation, and she was normal and healthy. But at 2 years old, she began to have eating problems. Mom states that she struggled when she tried new foods and she would cry at meal times. And so she was diagnosed by her pediatrician as having a sensory food aversion. And because of that, she has been working with an occupational therapist to address her sensory aversions. And Mom states also that since working with the occupational therapist, she's been showing improvement and sees the therapist less often. Unfortunately, Mom did not tell us or give information on how often she saw the therapist while she was being treated, and she did not give us information on how often she's seeing the therapist now that she's getting better. So I'll get with Mom to get that information and we can add it into the records. The family lives in Birmingham, Alabama, and consists of Mom, who's an accountant, and Dad, a surgeon, and brother, who's 8 years old. Mom and Dad work demanding hours, and so they spend a lot of time out of the home. Because of Mom and Dad's demanding work schedule, the child spent many weekends with her grandparents who also live in Birmingham, Alabama. On the weekends that the grandparents are not available, the babysitter, who's 20 years old, she takes care of the child. And on Monday through Thursdays, the child goes to daycare. On Fridays, Mom stays home and the child is taken care of by Mom. As a family, they enjoy going to the park, walking their dogs, and attending church. And the child also have play dates with the neighbor's child on the weekends. For our assessment overview, I'm going to share with you the family routines. I'm going to share the positive developments that the family has identified, and then I'm going to share with you the concerns that they still have for each routine. The first routine that we will talk about is her wake up routine. According to Mom, the child wakes at 6:45 and she's very happy and eager each morning with a very positive attitude. And she's very affectionate during her wake up routine. She hugs Mom tightly and is very happy to be awake except on the weekends when she may sleep a little longer. Mom states that she responds to her good morning greeting by repeating it back to her, but her concern is that she would like for the child to initiate the good morning greeting without it being said to her first. And the child is still only using one or two word um, responses. So that's her concern in this routine. The second routine that we'll talk about are meal times. We know that the child suffers from food aversions. Mom states that meal times are better since being in the sensory aversion therapy, and the child feeds herself and uses adaptive skills appropriately, she's able to put her straw into the container, she's able to wipe her mouth and feed herself, so meal times are not as challenging as they were before. Although the concern that the parents still have is that the child is not communicating when she needs assistance during meals. Mom says that she sits there and doesn't uh, try to get any help for any problems that she may have. Maybe she may have trouble opening a container or something to that effect, that she won't ask for help, or she'll just sit there. Okay, the next routine we're going to talk about is diapering. The child is very successful at home with her potty skills. She began pottying at 2 years, or training to potty at 2 years, and she is very successful with that at home. At home, they're using a visual chart to help the child identify when she needs to potty. And sometimes she's also able to verbalize the word potty. So at home, she wears regular underwear, and she's able to be very successful with her potty needs there. However, at school, she struggles to communicate the need to potty, and she wears pull-ups because she often wets herself. So mom is concerned about that and would like for the school to have a communication system for her potty needs. And that's a great idea, because visual supports, as we know, are key to the training and the supportive development of children with autism's adaptive and functional skills. So the thought is that mom, who's using a communicative device at home, a visual support, should take that visual support and introduce it to the classroom, introduce it to the teacher, and ask the teacher to implement that into the classroom for the child's benefit. Um, that would make it easy for the home and school to connect, because the child is already familiar with how to use that visual support. So it would not be um, troublesome, and it will not be new. So therefore, the success of the child should transfer from the home to the school with the use of that familiar device. The next routine we'll talk about is the outside time. The child loves playing outside. She loves playing in the sandbox, and she loves playing in the playhouse. She demonstrates her cognitive skills as she build sandcastles and connect things together. She also loves pouring sand into one object and out of the next object, and she demonstrates her motor skills. The problem is that she has no communicative skills, and her social emotional skills are lacking. So in that regard, we need to talk about strategies to help build the relationship and communication between the child and the classroom, because we don't want her to be isolated from what's going on in the classroom. So there are evidence-based practices that the teacher could incorporate into the classroom that would help make the classroom inclusive for this child. One of the strategies that could be included into the classroom is to have a peer partner, a partner or a play buddy that will be assigned to play with the child every day during free play time. And the teacher would also have to teach the child how to take turns. So that's a strategy also that could be incorporated. Turn taking strategies and peer support strategies, where children are being involved in the development of the skills of the child with autism or the child with needs. So those are several strategies that could be talked about with the teacher um, in order to help support the child. Next routine we'll talk about is bath time. Mom states that bath time is a really fun time for both her and the child. According to mom, the child uses more communication during that time. She asks mom to sing song. That's the favorite song that mom sings to her during bath time, and she requests it happily. And the child is learning how to use her adaptive skills. She's washing her body, learning how to wash her face, although she does have sensory issues with the soap. So mom has switched to the unscented soap. Unfortunately, the child is afraid of getting soap in her eyes. So mom would probably also want to look at switching to a no burn soap. There are soaps that doesn't irritate the eyes, more appropriate for children. So that needs to be brought to mom's attention also, and that would help during bath time. But that seems to be a positive time for them, and her skills are developing there. The next routine that we'll talk about is bedtime. This routine has been highlighted in red because it is the focus area that I would like to draw our attention to. This is bedtime, and bedtime is a critical area for the family. The child enjoys being read to every night, and she snuggles with her dad. He's the one um, that puts her to bed for the majority of the time. And she demonstrates early literacy skills as she turns the page after they are read. And so dad puts her to bed most nights. However, the problem comes on weekends when she spends the weekend with her grandparents and her dad isn't there. So she goes through a separation problem. She cries and screams and run around and refuses to get in bed because he's not there. So this is the area that I have chosen for a further discussion and a more in-depth look. The focus area questions that I asked to bring more light and understanding to this bedtime routine were questions that I thought could help understand whether this was a natural separation anxiety that young toddlers go through when they are in unfamiliar situations and they go through separation, but eventually, over a short period of time, when they become familiar with people, they grow out of that anxiety and can relax, or whether this was something that needed further attention. So I asked these questions. Does dad put her to bed every night through the week? I wanted to know if dad had established a routine that she looked forward to every night, and that by him not doing that routine on the weekends, it would disappoint her or send her into um, that kind of emotional, um, kind of like a withdrawal. The next question I asked is what happens at home when dad does not put her to bed? I wanted to know if this was particularly attached to dad. And if he doesn't put her to bed at home, does she still continue to go into that extreme emotional state? The third question I asked is, does dad use a special routine to put her to bed? Is there something special that he does that she missed? And it's something that she has grown attached to, and something that the grandparents could possibly incorporate at their home to help put her to bed. And the fourth question, how is the child calmed when she begins to cry, scream, run, and refuse to get in bed? Those are extreme emotional behaviors. And I wanted to know, how does the family handle that when she goes into that? Is she consolable? Because that can be an insight into another issue also, such as a separation anxiety disorder. So, and she has autism. So we have to remember that routine is important for children with autism. Then the last and final question, does the child have separation issues at any other time? Throughout the entire week, when dad's not there, at any other time, does she go through these emotional extremes when he's not there? At any other time other than bedtime? So, is bedtime the only time that she goes through these emotional extremes, when dad doesn't put her to bed, or when he's gone to work throughout the day and he's not home throughout the day? Does she go through those extremes? I thought those were critical questions to ask, and we'll see how they are answered. According to mom's responses to the question, the child still go into her extreme behaviors at home when dad doesn't put her to bed. Mom, sometimes her and dad, according to the answers, try to switch off so that she will become comfortable with both of them putting her to bed. And so mom responds that when she tries to put her to bed, she also goes into that extreme behavior, and it takes a while to calm her from those extreme behaviors, even at home. And so this suggests that something deeper is going on with her, because mom is a familiar face and the environment that she's in is a familiar place. So that shouldn't trigger an anxiety response, even though dad, who is the most common one to put her to bed, even though he's not putting her to bed, she still should not go into anxiety mode, because mom is a familiar face and the home environment is a familiar place. So to go to that extreme, even in her familiar place, suggests that something more is going on. And so, according to research on children with autism, it is said that that children with autism uh, often attach themselves to individuals. So this is possibly what we are looking at, that she has attached herself to her dad, because she does spend most of her nights with him, being put to bed by him. And he does the routine, singing the song and reading the stories while he lays beside her. That routine evidently has allowed her to attach herself to him, because it may have brought her into a safe zone that she loves. So that's what I gather from mom's response. To help address the issue of bedtime routines, I'm going to share strategies from two evidence-based practices. The first practice is applied behavior analysis therapy, ABA. The first strategy within that practice is to practice separation. Talk to the child about what is going to happen and when it's going to happen. I think it would be also helpful to use a picture visual to show the trip from your house to grandparents' house, um, and have a picture of the bedroom. The next strategy, leave without a fuss. Once you drop the child off at grandma and grandpa, don't show your concerns about leaving, just leave. The next strategy is to stick to a routine. Establish the routine of using the visual to show the trip from your house to grandparents' house, and encourage the grandparents to establish a bedtime routine. And once they have established that bedtime routine, provide a picture of dad at bedtime. That could be a part of the routine. And the next strategy and the last strategy from this practice, if extreme behaviors continue, you may want to talk to your pediatrician about seeing a therapist. It could be a little deeper than that. The second strategy is cognitive behavioral therapy, CBT. In the cognitive behavioral therapy, the first strategy is to identify triggers. So we know the child has sensory aversions, and according to research, sensory overload can trigger meltdowns. So in this instance, lights, sounds, smells, and textures could be triggers for that child going into that overload mode, especially coming from the natural home environment into grandparents' environment where the smells, the lights, the sounds, textures are all different. It could trigger that sensory overload response. The next therapy, the next strategy in this practice is to practice exposure therapy. That's a gradual introduction into change. But since she's already been going through the change, the exposure therapy is kind of like null and void in this situation. But just keep it in mind for other instances. And the next strategy in the CBT therapy is deep touch pressure. Using a weighted blanket at night might be helpful. Using a weighted blanket with a picture of dad could be helpful, and have the grandparents establish a routine where they are also reading a book and singing a favorite song could be a could be could be helpful. And the next strategy, if you need more help, look into behavioral interventions for anxiety in children with autism, BIACA. I think these strategies could be helpful. I think that a mixing and a mating of several strategies could be helpful, such as from the ABA, if you had pictures of dad and a visual schedule, and then used the deep touch pressure from the CBT, I think that could be helpful. And also identifying triggers in grandparents' house, that could be helpful. So hopefully these suggestions will be helpful. Primary role of a service provider in early intervention is to work with and support family members and caregivers by providing them with interventions that are evidence-based practices designed to enhance their child's learning and development. The challenge that I had with this family were to find interventions that were evidence-based to support their child's separation anxiety. And I feel as if I was able to do that. And not only was this intervention going to be supportive of the separation anxiety, but it will also, with the ABA strategy, ABA therapy, it will also address the child's communication needs also. So I believe that they have been provided intervention service that could help in multiple routine areas.